video was produced to help Medicare patients to understand the Medicare Outpatient Observation Notice, also known as the MOON. This information is for patients who receive Medicare benefits and is intended to address a recent change in guidelines from the Center for Medicare and Medicaid Services. You have been admitted to the hospital as an outpatient receiving observation services. This means that your doctor has decided that he or she would like to complete further testing and monitor you closely to determine if you will need to stay at the hospital longer for an inpatient stay. Hospital staff are available to answer any questions you have about your diagnosis and condition. However, even though you are in the hospital, you are not technically considered to be an inpatient at this time. When you are a Medicare patient in observation, your Medicare Part B will cover your stay for Medicare-approved covered services. Any copays and deductibles required by your Part B insurance will apply to this observation stay. Medicare Part B copayments are usually 20% of the allowed amount for services you receive, and the Part B deductible is applied to that amount. If you have a second or supplemental insurance, it may cover the copay and deductible amounts for you. We recommend that you contact your secondary or supplemental insurance carrier to confirm any potential additional insurance coverage. If your doctor decides you need a longer inpatient stay, your insurance coverage will change to your Medicare Part A, and the inpatient deductible will apply. The deductible amount will depend on what type of Medicare you are enrolled in, but it can be $1,300 or more for traditional Medicare. Medicare requires hospitals to notify you of your observation status so that you will understand your coverage. There are several things about this observation stay that you need to know. The first is, to qualify for nursing home coverage under Medicare, you must be an inpatient for 3 days. The days you spend in observation do not count towards the 3 days, even though you are in the hospital. If this becomes a concern, please let the staff know and they will have your case manager explain it to you in more detail. Another important thing to note is, when you are an observation patient or an outpatient, Medicare does not cover the medications you take by mouth. Those medications are billed to you because they are considered non-covered and self-administered drugs. Some hospitals will waive the amount of the self-administered drugs. Ask hospital staff if you will receive a bill for the medications you are receiving by mouth. We are going to ask you to sign a form called the Medicare Outpatient Observation Notice. We call it the MOON form. By signing this form, you are acknowledging that you understand you are an observation patient. It is not considered a guarantee for payment. The main purpose of this form is to make sure you understand that at this time, your Part B insurance applies. If your doctor decides you need to stay for a longer time as an inpatient, your insurance coverage will change to Medicare Part A. If you have any further questions, we will be happy to answer them before you sign the MOON form. If you are not able to sign, your family or legal representative can sign it for you. We wish you well and hope that you recover quickly.